mini-series right where we left off. So last time we finished off with the vertebral ligaments throughout the entire spine. So we'd covered the spine pretty in depth in the last few installments, but today we're going to dive into musculature, specifically this time the muscles of the back. There's a general overview here. A lot happening over a wide space, and they have it kind of broken down region by region. So I'm not exactly sure just how far we'll get today, but we'll see what makes sense, because I don't want a video to ever be too long or too short. Still kind of trying to figure out what exactly that sweet spot is. As always, open to feedback on what you think that is, because I want this content to be informative, relaxing, enjoyable, you name it, really. I want it to be something that you all can come back to and enjoy multiple times, but I know there's a lot of content creators out there doing a lot of good stuff, so I appreciate you just taking a little bit of time to spend time with me here as we talk about something that interests me and hopefully interests you too. So, without further ado, let's dive in. The muscles of the back. It says the muscles of the back are divided into two groups, the extrinsic and intrinsic muscles, which are separated by the posterior layer of the thoracolumbar fascia. The superficial extrinsic muscles are considered muscles of the upper limb that have migrated to the back. These muscles are discussed in upper limb, pages 312 through 317. Then we've got figure 3.1 here. The superficial extrinsic muscles of the back, posterior view. And on this side, they've removed the trapezius and the latissimus dorsi on this side, revealing thoracolumbar fascia. It says, note, the posterior layer of the thoracolumbar fascia is reinforced by the aponeurotic origin of the latissimus dorsi. So, let's get into the extrinsic, and then we can get into some of the interior muscles that are revealed by the removal of these extrinsic muscles. So you've got the trapezius, the descending part, the trapezius of the transverse part, and this muscle here is, whenever you see weightlifters who have really big shoulders, or they kind of, or jokingly sometimes they're referred to as having no neck, it's because they have big trap muscles, they're called in slang trap muscles, right here. They'll have like a bulge right here, this muscle's built up and out. The scapular spine, so getting into some skeletal structure here of what it's built off of. The deltoid here, it's kind of like the cap of your shoulder. The teres major, and then the ascending part of the trapezius is here. So we got descending, ascending, and transverse. And then triceps brachii here. And triceps is interesting, I'm sure it'll talk about this, but tri meaning three, and then ceps is from cephalic, which means heads. So the triceps has three different heads, and we can see two of them here. Latissimus dorsi, or commonly for people who work out a lot, you'll hear it referred to as the lats. You need this muscle group especially to be able to do pull-ups. The thoracolumbar fascia, you can see it here and here. Posterior layer. The olecranon process here, which is basically the pointy part of your elbow. So if you flex your arm and feel your point, the point of the elbow, it's going to be right there. The aponeurotic origin of the latissimus dorsi, as referred to up here. And then the lumbar triangle. The internal oblique is visible through there. And we'll talk, more of that will be discussed, but the lumbar triangle is basically a juncture of three different muscles, where there's just a tiny little gap that you can see deeper into the spine, or into the back, excuse me. And then the gluteal aponeurosis, and we'll talk about what an aponeurosis is too later. On the underside, you got the sternocleidomastoid here, and it's pretty appropriately named because it has three attachment points. Sterno attaches to your sternum, the hard bony part in the middle of your chest. Cleido for clavicle, cleidomastoid process here on the back of the skull, which we covered before. And then another view of the thoracolumbar fascia and the deep layer of nuchal fascia. The rhomboid minor is here. The levator scapulae, and this is pretty appropriately named because levator, think levitate, which means or think lift, and then scapulae, so scapula. So it lifts your scapula. That's its whole job. And then your clavicle here, which is again a tendon attachment point of the sternocleidomastoid. So this clavicle runs down to the front here. We just can't see it. The acromion process is out here, part of your clavicle. The supraspinatus is a muscle tucked away in here. The rhomboid major here, and usually more often than not, if you hear a major or if you hear a minor, you can expect the other. So rhomboid minor, rhomboid major. The infraspinatus, appropriately named because infra, you can think below. Infraspinatus, below the spine of the scapula. And then the scapula itself is the medial border. Teres major, so we hear a major, so at some point we're probably going to find a minor. Serratus anterior, which is kind of a musculature layer that runs just under your latissimus dorsi. It kind of supports that pull-up effort. And then the serratus posterior inferior. External oblique and internal oblique. Oh, and gluteus maximus, or your butt. So, we'll go over here to thoracolumbar fascia, figure 3.2. We got a transverse section, superior view. So, we've taken it shows us here alphally, we've taken a cut where we've taken it and we've turned it up like this and cut it in half. So it's a transverse section looking down into it. The intrinsic back muscles are sequestered in an osteofibrous canal formed by the thoracolumbar fascia, the vertebral arches, and the spinous and transverse processes of the associated vertebrae. The thoracolumbar fascia consists of a posterior and middle layer that unite at the lateral margin of the intrinsic back muscles. In the neck, the posterior layer bends with the nuchal fascia, or deep layer, becoming continuous with the deep cervical fascia, prevertebral layer. So, there's a lot to see here that you're looking down into. As always, let's orient ourselves, right? So, hopefully, we see the esophagus here, so we know that this is going to be the anterior portion of the body, right here. This is going to be, their head would be right here facing forward. And then this is going to be the posterior side back here. So, we've got your esophagus here. That's definitely a defining feature that we can identify along with your trachea. Your thyroid gland is right here. Your infrahyoid muscles are right here. And then that sternocleidomastoid that runs right along. We saw it here, is over here and here. So we got a view. This would be the right sternocleidomastoid that we see here. And then, there's a lot to get into. The pretracheal visceral layer, again, that thyroid gland, which actually starts out large when you're young and shrinks as you get older. The infrahyoid muscles, we already talked about that. The internal jugular vein over here. So if you ever see that giant vein on the side of somebody's neck, especially if they're like holding their breath or bearing down, that's the jugular vein. The carotid sheath is this protective layer out here. Your vagus nerve runs right next to it, and this is associated with passing out. So if the carotid artery and the jugular and the vagus are compressed, if someone's holding pressure to your neck, that interaction here, and especially with the nerve, is what can cause you to pass out. Common carotid artery is this feature right here. So we got usually anytime you see a vein, kind of like with major and minor, artery associated next to it. And then we've got the brachial plexus, which if you've never heard of that before, it's a whole series of nerves that basically it comes down here through your shoulder and controls most of your arms, comes out of your cervical vertebrae and controls a lot of the function of these upper back muscles in your arms. We'll get into that later. Let's not spoil the good stuff early. And then hopefully this tells you that we're at the C6 level. So that would mean that we're probably about right in this area. Because remember, C7 is the vertebra prominence, that prominent palpable point back here. Levator scapulae, which is there. And then you've got intrinsic back muscles, the trapezius. So we're getting to the exterior here, obviously. Deep layer, it says, so that's fascia. And then a superficial layer of nuchal fascia. Longus colli, the scalene muscles, and then the spinal cord as well. So that's another major defining feature that's identifiable. And then that means that coming back here, you're going to have your vertebral processes back through here. And then here, so here we're at C6, and down here we're going to be at L2. So we're in the lumbar region now. And so some of these features are going to look very different. You've got your vertebral body again here, like we had here. Your spinal cord's going to be running through here. Now you're in the abdomen. So you've got your abdominal aorta, which is the huge artery running through your midsection, the inferior vena cava. You've got parietal peritoneum and psoas fascia. And so this is the psoas, which is a major muscle of your back, and then the fascia that goes around it. Your kidney here, renal fascia, which renal means kidney, so it's covering that. Your lateral abdominal wall muscles, your transversalis fascia, which covers transverse muscles, or takes care of that. Your fibrous capsule, so just another protective layer around the kidney. Renal fascia, posterior layer. Your lat muscle. Your serratus, posterior, inferior. So you see it here, and you see it here. Quadratus lumborum. That's a big one too. Your lumbar region. It's a large muscle along with the psoas that allows you to stand up. Anterior layer of the quadratus lumborum fascia, and then the middle layer here, and then the posterior layer, and then this is part of thoracolumbar fascia. So these two kind of run concurrently with each other. And then of course your transverse process, your vertebral arch, the features that we've already covered pretty in depth when it comes to the vertebrae. How much further shall we go? I think we'll at least get through one more page here. Intrinsic muscles of the cervical spine. So the muscles of the nuchal region. And if you remember, the nuchal region is kind of that prominence on the occiput of the back of the skull. Posterior view, and removed is the trapezius, the sternocleidomastoid, the splenius, and the semispinalis muscles. So these are all here, and then they're taken away over here so that we can see deeper within. And then even the nuchal muscle, nuchal muscles are taken away too. So we got the parietal bone, the occipital bone, superior nuchal line, external occipital protuberance. So just think that knot on the back of the base of your head that you can feel. The semispinalis capitis, the splenius capitis is here, and then the sternocleidomastoid, it's cut here. I mean, obviously it's the same muscles, they're just cut away over here. The rectus capitis, now we're inside below these muscles that were removed that we've already talked about. The rectus capitis. So rectus, this thing like straightening, so it allows you to straighten your head. And then the rectus capitis posterior major, and the splenius capitis. latissimus capitis here, the semispinalis, which is transverse cut, splenius capitis, transverse cut, and the splenius cervicis, which runs up and around. So, if you've never put a whole lot of thought into it, please realize there is a lot of musculature happening within this range here that allows you to move your neck and your head with the range of motion that you have. So when you pull a muscle in your neck, it's one of these muscles is likely to be the culprit. Figure 3.4, short nuchal muscles, posterior view. 3 of the short nuchal muscles, obliquus capitis inferior, obliquus capitis superior, and the rectus capitis posterior major, form the boundaries of the suboccipital triangle. So, anatomy loves a good triangle when we can find it. So we had our lumbar triangle over here. Well, this time we're talking about a suboccipital triangle. So let's see if they lay it out for us pretty clearly. Otherwise, we might have to find it. So you got your trapezius, your rectus capitis minor, your semispinalis capitis is right in here. Your sternocleidomastoid, transverse cut, splenius capitis, transverse cut, obliquus capitis superior, your longissimus capitis, transverse cut. You've got your transverse process of C1, right here, your atlas muscle, your rectus capitis major, right here, your obliquus capitis inferior here, your intertransverse cervicis here. So it's just a very interesting little muscle that connects between your cervical vertebrae, and then that palpable, prominent transverse process here at C7. Mastoid process, so that's the connecting point for the sternocleidomastoid. Posterior atlanto-occipital membrane pierced by the vertebral artery, deep in here. Posterior arch of the atlas, spinous process, interspinalis cervicis, so another muscle between the vertebral bodies to help with that connectivity and the movement itself, supplemental to the movement. And then the transverse process of C7. And so, since it didn't show us the boundaries of the suboccipital triangle, let's see for where that would be. So let's see, can we find the obliquus capitis inferior here? The obliquus capitis superior. Where is that at? So it would be, inferior. The superior is in this range here. Unfortunately, it's cut. And the rectus capitis posterior major. So rectus capitis posterior major. So it would be a triangle in this range right here. And then we've got the suboccipital region. Muscle origins are shown in red and insertions are in blue. Now that brings up an interesting point that we haven't talked about yet. Origins and insertions. When you hear origin, think starting point. Relatively intuitive, but still. And then the insertion is where it goes. So, if we were to think about this kind of practically, trying to think of a good example that I can show you, but, if you have your hand itself, the origin of some of the musculature through your finger is going to start down here, and then the insertion is going to be down here. And because of the origin down here and the insertion down here, it works to draw your finger in. So, that's kind of how origins and insertions work together. Semispinalis capitis here, rectus capitis posterior minor here and here. So, again, origins are shown in red, insertions are shown in blue. So, meaning that the origin is going to be here and the insertion is going to be here. Origin of the rectus capitis posterior major here, insertion here. So it's going to be able to pull this way. This is going to pull this way. The trapezius starts here. Obviously, we don't get to see the insertion. Sternocleidomastoid. This is an insertion. So the origin is going to be muscles of the back. This is very detailed, and I want to give ample time to go through each of these things. I think we can do it. We've covered most of this already. The extrinsic muscles of the back, the trapezius, latissimus dorsi, levator scapulae, and rhomboids are discussed in the upper limb, pages 316 to 317. So, we're on page 28. You're going to have to hang out with me for a little while to get to that point. The serratus posterior, considered an intermediate extrinsic back muscle, has been included with the superficial intrinsic muscles in this unit. So we got thoracal lumbar fascia, deep layer of nuchal fascia, the rhomboids, major and minor they've got a cut. They've been transected. The serratus posterior superior, external intercostal muscles, serratus posterior inferior, latissimus dorsi, external oblique, gluteus maximus. So a lot of these that we've already covered. Iliac crest is a new feature to be included. This is really showing us the thoracal lumbar fascia, and what's removed is the shoulder girdles and the extrinsic back muscles, except for serratus posterior and aponeurotic origin of the latissimus dorsi. What's revealed by doing that is the posterior layer of the thoracal lumbar fascia. So when you see this white, just think fascia. Semispinalis capitis, splenius capitis, splenius cervicis, thoracal lumbar fascia again, intercostal muscles. Spinalis is a fun one because it runs the full length of your back. The iliocostalis, which is appropriately named because it runs from your costal or your vertebrae. Think intercostal space or costal vertebrae. So iliocostalis is going to run from your costal attachments to the ilium. Longissimus dorsi, or longissimus here, not longissimus dorsi. That's latissimus dorsi. Longissimus is another long muscle of the back. Obliques over here. And then another view of intermediate and deep intrinsic back muscles, and removed is longissimus thoracis and cervicis, the splenius muscles on the left, the iliocostalis on the right. The posterior layer of the thoracal lumbar fascia gives origin to the internal oblique and transversus abdominis. So we're really revealing some of the deep muscles of the back here. The iliocostalis thoracis, levatoris costarum, the spinalis, the iliocostalis lumborum, the transversus abdominis, iliac crest again, those intercostal muscles. Longissimus, we get to see another view, a little bit more unobstructed. Internal oblique, the capitis is semispinalis and splenius, and the splenius cervicis. And then a few new ones over here. So deep intrinsic back muscles. Let's see, obliquus capitis. We've covered the interspinalis cervicis. The rotatories, the thoracis longi, in here, tucked deep in here. Rotatories, the thoracis brevis, so longi, long, brevis, short. External intercostal muscles, again, the 12th rib, the intertransversarii lateralis lumborum. Go ahead and say that 5 times fast. The costal processes, the quadratus lumborum again. The multifidus, which is another major back muscle, all tucked here in the kind of the lumbar sacral region. Interspinalis lumborum, transversus abdominis, the iliac crest. Levatoris costarum brevis, the intertransversarii medialis lumborum. Here. Just all kinds of, if nothing else, I hope that everybody comes away with an understanding of how much musculature is at work just in simple basic movements, and that you have an appreciation for your body and the ability to move that you do. This here is moving into muscle facts, so I'd say that this is a good place to stop for today. I hope everyone is having a great holiday season so far. I'll try to get out at least one more video to you all prior to Christmas. So as always, if you want to see more, please like and subscribe. And yeah, I appreciate your time. Have a great rest. rest of your day. Until next time.